are here for a work session and subsequently a closed session discussion of the board. The work session is on COVID-19 and just big picture. We have 3.8% positivity rate in Arlington over the last week, but we have seen a slight uptick in cases nationally. We have vaccine coming, but we also have the challenge of the concern about variants that led our CDC director nationally yesterday to plead with everyone to keep wearing a mask, washing their hands, and keep social distancing. So that's sort of the moment we're in, and we'll send it to the manager so that we can have this work session on Arlington's efforts. Mr. Manager.
Thank you, Mr. Chair, members of the board. Let's get right into it. We have 8 slides that we'd like to walk you through at the beginning. If you could let us actually walk through each of the 8 slides, and then there's going to be many points in here I think you're going to want some follow-up on. So what we'll do is I'm going to turn it over to Dr. Varghese to start us off. Dr. Miller will talk a little bit about testing and some other issues, and then Brian Helfer will also weigh in with some information. So over to you, Dr. Varghese.
Well, good afternoon, and my computer decided to reboot just before, so you're seeing me on the iPhone, so my apologies. We're working on this end. So let's go ahead to the next slide.
Are you all seeing the slides?
We are, or we were.
We were, yeah.
Awesome. Okay.
Okay. So you're all familiar with a pandemic curve that we've been showing before. We seem to be plateauing off in March around the 200 mark, and this goes to Mr. DeFranti's point about what the CDC director has been talking about. Plateauing is not what I think any of us would like to see. Obviously, we prefer plateauing to increasing, but we'd like this curve to continue to decrease. And with people gathering together more, it is entirely possible that germ transmission can still occur, because this is proof that the virus is still in our community and all over the nation. So we really need people, even if they've been vaccinated, to protect other people and themselves from the spread and continue the other precautions, because first of all, not everyone is vaccinated yet, and we'll get to those topics. And so this is the way to protect ourselves and others. And as I've said before, the length of that. Next slide. Dr. Miller, would you like to talk about these?
Perfect. Good afternoon, Mr. Chair, Mr. Manager, board members. Thank you for having me again. Arlington County continues to provide a robust, no appointment, no cost, no referral testing options at several locations throughout the community. As the chair mentioned at the top of his comments, the current 7-day test positivity rate for the PCR tests is at about 3.8%. So that is significantly lower than it has been over the past few weeks. However, we also are seeing a little bit of a reduced demand in testing. We're at about 700 to 800 tests a day throughout Arlington County right now. We're starting to see that pick up a little bit. We suspect that it is because of spring break, frankly, and people wanting to travel. As a reminder, though, our locations that we have available for testing: Arlington Mill Community Center, Aurora Hills Community Center, Tucker Field at Barcroft Park, and then the mobile testing option that you see pictured here through Quest. So that was, remember, we did have the drive-through at North Quincy. We found that folks really wanted more no barrier, low barrier, no cost options. So we moved to the mobile format. That is operating this week out of 601 South Carlin Springs Road. And I do want to announce that within the next 2 weeks, we are going to add another no cost, no appointment, no referral testing kiosk in the courthouse area. It will be open the first day on April the 13th, and the hours will be 12 to 8, 7 days a week. And so when that comes online, that'll represent yet another avenue for our community to be able to receive tests. As of yesterday, across all of Arlington's testing locations, we have had 42,590 tests offered to our community. And that's out of a total of about 209,000 PCR tests. So Arlington's efforts still represent about 20% of the testing capacity within the entire county, which is good. That's obviously an important piece of keeping the community healthy and safe.
Thank you, Dr. Miller. Is this a Dr. Varghese slide or a?
It's the Dr. Varghese slide. Thank you, Mr. DeFranti.
Sure.
Back now on a regular camera. So just wanted to talk about the current status of vaccine distribution, who is currently being scheduled for vaccine. So all of the groups in green are currently in the phase 1A or phase 1B categories. The last movement was in the continuity of government, which we've completed all of those that we've currently had. Waiting to move through, we are still waiting to advance to the clergy, faith leaders, and the janitorial and custodial staff. And then in the gray area, you see who's not yet eligible. The long and the short of it is that we're moving as quickly as we can through these phases, and we're hoping, as well as the Commonwealth, to be able to be introducing the general public, hopefully no later than the end of April, beginning of May. So that's the goal if everything goes well, and we still have a month to get through it. And if we under-promise and over-deliver, hopefully people will be happy with that. Next slide. So this is a graphic showing the distribution locations for vaccine in Arlington. Not all of them are operating simultaneously. For example, the ones that have been run by the Arlington Public Health Division include sites at the Sequoia Complex, Lubber Run, Walter Reed, and the Amazon headquarters that started this week as well, and JVG Smith. We're not running all 4 of those simultaneously, although this week it's the first week we've done 3 of those sites. We're currently at the Amazon site, Lubber Run, and 2 days this week at Walter Reed. And by the end of the week, we will have capacity to do roughly 14,000 first and second doses among these sites. 2 of our equity efforts specifically are working with the Arlington Free Clinic and the Neighborhood Health, which is a federally qualified health center, to reach out to those who are traditionally underserved in these areas. And then a reminder to the public, there are also the federal pharmacy program participating pharmacies, and in Arlington, that is CVS's, Safeways, Giants, and Harris Teeters. And so all of these require an appointment, and so look for those appointments as the weeks happen. Next slide. People want to know how we're doing with our division supply of vaccine, and this past week we received over 9,000 doses of vaccine, and among first doses to this point, we have received 37,895 doses, and at the end of last week, we administered 37,141 doses for 98% utilization, and no one should worry about the difference being wasted doses. Those are doses that then remain on the shelf to be able to start the next week in case we don't receive our next vaccine supply. We don't have to cancel appointments. And then second doses will obviously lag first doses. And out of 19,600 second doses that could be administered, we've administered 17,666 for a 90% administration rate, which we believe is quite fantastic. Next slide. Finally, I know people have been wondering about the demographic characteristics of those that we have vaccinated through the Arlington County Public Health Division. These numbers will be different than what's on the state database, but part of the reason we present this is we can actually give you a better or number of demographics for race and ethnicity than the state database. Close to 43% of the data for the state is missing that data. We're missing overall 7% of that data, so it makes us more confident in the distribution of our efforts. So what I'm going to ask people to do is look at the column first that says all ACPHD vaccine for Arlington residents and non-Arlington residents, just as a way to orient yourself. That's all of the data for people that we've vaccinated with 1 or more doses through March 27th. And then on the far left, where it says through March 27th, you'll see the various categories of demographics, Hispanic or Latino. The NH that follows is for non-Hispanic, and that's non-Hispanic American Indian, non-Hispanic Asian, non-Hispanic Black African American. You'll see that people do have the option to decline to specify race. We've actually been very good, had little of that. Non-Hispanic, other Pacific Islander, the other categories. You'll also see non-Hispanic, not known or reported, non-Hispanic white, and then non-Hispanic 2+ races, and then finally unknown and unreported, sorry. And that's the number. It's about 7% for Arlington residents and 6.7% for the non-Arlington residents. The final column is the American Community Survey population percentages for and counts for the community. And the reason why we do that is so that people can see when we look at the percentages, what percentage of those who we vaccinate in comparison to our population. And the only group that tracks roughly with its population percentage is non-Hispanic white. Among Arlington residents, actually 66% are non-Hispanic white, where the total population is about 60.9%. Obviously, definitely concerned that the uptake among the other groups is below their population percentages, and that is why, as we do the herd immunity efforts, we're also focusing on equity efforts. It's not a perfect science, and over time, as vaccine supplies grow and the efforts of the CDC continue, we're hoping that we will be able to catch up there, but it is something we are definitely aware of. Can't remember if there's another slide. There is, okay. People want to know about the pre-registration status in Arlington. So as of March 29th, we have roughly 34,000 people waiting for notification. Why we say roughly is because people can decide to join at any time afterwards. And in a sense, with vaccine hesitancy, we want people to join. And since the very beginning, we've had people who were healthcare workers who have finally decided they want to get it. You know, no harm, no foul. We want them to get vaccinated. If a 65-year-old decides today to sign up, well, great, because our long-term goal is to have as close to 100% of our population vaccinated who are eligible. So people are familiar with how we've been looking at things at the state and national level. There are those at more complication risk, and that would be those who are 65 and older. And as of the 29th, we had 1,100 people in that category, and we had at one point had finished with them all, but as people register or decide to come up, they get into the system. We are currently at 14,000 people with underlying medical conditions from the ages of 16 to 64. That totals to 15,146 as of today. Those are increased exposure risk. We now have 762 healthcare workers. We have 5,252 phase 1B frontline essential workers, and that does include the clergy and janitorial custodial staff. And then in the phase 1C essential workers, we have 13,249 people currently pre-registered for a total of 19,263. So that is the status, and we keep inviting at least once a week, if not more often, because we want to make sure that we have the least number of slots left open. And so we will always over-invite rather than under-invite. And I know some people are scared about that, but the worst thing that happens is then the few people who do want the vaccines will go into the following week and the same link works for them to be able to vaccinate. But there have been times when we've invited many times during one day to make sure that the rest of the week gets filled, because we can't be sure if all of the people on the list may have been vaccinated elsewhere, or they may have pre-registered because they were hoping to keep a place in their line, but they're not ready to actually get vaccinated. And so then it just allows us to invite more individuals. And Brian, is there one more? No, okay, we're done.
Great, thank you, Dr. Varghese and Dr. Helfer, as well as Dr. Miller. We will open it up for questions, and happy to take if there's anyone who has a question off the bat. I also have one in hand. So let me start though with colleagues. I think we had Mr. Dorsey first, and then Mr. Carantonis, then Ms. Crystal. Mr. Dorsey.
Thank you, Mr. Chair, and Dr. Varghese, thank you for the information, and thank you for the much more useful slide on demographics for vaccine take-up. And, you know, I just want to applaud that, one, we have focused on what we can control, and that is the shots that we deliver. And I applaud the team for collecting robust demographic data. It stands in stark contrast to what we're seeing statewide and nationally. So I definitely appreciate that. Less a question than an overall comment, but I invite your feedback on it. You know, when people look at a chart like that, what will jump out at them, as it did with your analysis, is the disproportionality, and seeing that people who have been known to be most affected don't have necessarily the same take-up as non-Hispanic whites. Yet at the same time, one of the things that's available for future analysis is how this relates to eligibility. So in another way, even if demand for the vaccine was equal across all groups, not everyone has had access to it at this point. So you're looking at your population, your resident population above the age of 64 primarily, which I believe survey data show that that is disproportionately white. And then excluded entirely from this process to this point have been anyone under the age of 18, which are largely made up of children of color. So at some point, I hope that we can add to this analysis some of the expected outcomes based on the age distribution, because I don't want people to automatically look at this and reach the conclusion that somehow something is fundamentally broken. We don't know that yet, and we have more room for analysis to tell an even greater picture.
Your analysis, I think, is spot on, Mr. Dorsey. All we can conclude right now is this is who was able to get into the system in many ways. I am going to make a bold statement that we've seen that the infrastructure and how things work in our society, not just here in Arlington, but across at least the nation, there are infrastructural disparities in the system. And so it's going to disproportionately affect one group over the other. And that is unfortunately something that Destination 2027 identified. You all are aware about it, and it doesn't automatically change just because we've recognized it. For example, an internet email-based system was going to disenfranchise some more than others. It's what the CDC had to put together. And so one of the things that I try to remind people, including myself, is we're not just focused on equity, we're also focused on herd immunity. And so it's both, not one or the other, because the more people we actually get with herd immunity, hopefully will reduce the exposures of people who are at more risk for exposure. So I'd like it to be that we could do both at 100%, and the reality is that's probably not going to happen. And so sometimes we're further ahead on herd immunity, and sometimes we can move up on the equity. And I'm very grateful that the CDC is trying to correct the equity issues by getting more people registered. But once again, once you're in line, you have to wait your turn, and that may not always be seen as equitable, and I apologize for that.
And that's actually my second question, is where you ended up. If I could just throw it in quickly, in terms of waiting the turn, Right now, what is the sort of typical turnaround for someone who is a part of an eligible group if they were today to say, you know what, I've not engaged thus far, but I'm ready to do it. They go ahead and sign up. Can you give us a sense of how long it should take before they are given an opportunity to receive the vaccine?
Well, I'm going to do simple math at this point. So we had roughly about 33,000 people all the way through 1C as of the 29th. If we're doing, say, 7,000 new doses per week, I'm just picking that number out of being able to do 14,000 if we do roughly half and half, well, then the math would take about 4.5 weeks for that to happen. Now, here are the things that we also recognize. Supply will increase, and there are going to be other places, including the state-run centers that should be coming online to help with this problem. And not everyone who's signed up will actually want the vaccine at that point. And as I've said, there was one 5-day period where we ended up sending out over 10,000 invitations when we started out with, say, 4, because we needed to populate it. Will they change their mind? It's entirely possible. And then if they come back into the system, there may not be as many. So that's why I know people are a little frustrated that I can't give a specific answer, but part of it is when people get engaged and interested, then suddenly there may be more people fighting for the same number of slots. But at the worst case scenario, it's hopefully no less than 4.5 weeks from now.
Thank you so much.
Thank you, Mr. Dorsey, for the question in particular. And I know Dr. Varghese, we seek to be very not overpromise. And this is the first time in some time that I've heard we say 4.5 weeks for depending, and that's a time frame. So I think Mr. Karantonis was next, and then Ms. Crystal.
Mr. Chair, didn't you have a question that you just froze for a second?
No, I'll let you go. You go ahead first. I'll come back. I still have that one.
So a little bit. Thank you. So a little bit following Mr. Dorsey's remarks on how to deal and how to represent, first of all, the position of hard-to-reach communities and underserved communities right now. So we have been discussing for quite a while now how we can improve our game. And this is probably a question both for Dr. Helfer and the county manager. So one critical thing that we've seen in the field is that really we have to reach out and register as many people as we can. And we use the CDC for that, the Committee for the Complete Vaccination, the Complete Vaccination Committee, actually, I should say. Now, we at some point, I thought that we are at a point where we have sufficient supply and sufficient capacity to really contemplate to up our game there. What is the possibility to hire some canvassers, paid canvassers, who would, just roam 24/7, door to door, location for location? We know where most people are, and actually take them in, put them in the line, and get them in the system. Related to that, and maybe you can answer both at the same time, is so we have these 4 locations right now. I've heard time and again, especially on the west end of Columbia Pike, where people are already, they have for quite a long time they've had the testing site, that it would be helpful to have a satellite vaccination site close by. So what is the hold up for that? People have seen that, for example, at the Macedonian Baptist Church, a pop-up was possible. Neighborhood Health made it happen. So why wouldn't we be able to do something similar in the Western Pike? It's also a good thing for, bringing the concept of the vaccination closer to communities that are not best exposed to that right now.
Yes, that's it.
We're going to let, Dr. Helfer can start off. And then we also have some, I think that Dr. Varghese will have, and Dr. Miller will have some comments about the use of Arlington Mill.
Yeah, thanks. So the Complete Vaccination Committee, as everyone knows, is a group of community leaders who are doing amazing work in the community. And we're currently doing about 7 pop-ups where we're out in the community in neighborhoods where folks might not have awareness. We also have 147 partners, and we are actively training all of our partners on how to work through the pre-registration and help others through it. And what we're hearing is some organizations are actually offering one-on-one assistance to their network. Some people are hosting virtual sessions with their members. Others are like, the Latino Caucus, who are outside of Megamart and Glebe Market on a regular basis, in addition to the ones we're doing. And so we're really trying to use all of our network to do more and more outreach. We learned yesterday there's a group of building ambassadors in multifamily buildings that the Virginia Democrats have. They're going to be helping us get information out in those high-rise buildings. We are actively working with the faith community to make sure they know how to access the information and individually help people. So it's really, I think, a multiple tier approach. Door to door during COVID is a little, we didn't do much of that. We didn't do a lot of that during census. Census workers did some of it, but I think, at this point, we're really trying to leverage all of our connections and resources and trusted advisors in the community, and hopefully do more and more of that as we gain momentum.
Great. So that, I think, is an answer on the canvassers. Is there? I don't know. There's Dr. Miller on Arlington Mill, or Mr. Manager.
No, we'll let Ruben start off, and then if Aaron has limitations to add, he can do that.
So we would love to be able to use a facility like Arlington Mill, but for the herd immunity and trying to also do some mass vaccination, the testing is still a very important thing, and that space is going to be just as important for that as for the vaccine. And so it was a conscious decision, and its footprint is more vertical than horizontal. And so to be able to have enough throughput for the larger efforts, that was one of the decision-making points, because we're still going to have testing for that part of the community, because as you've seen, CDC has recommended things for employer groups and schools and so on, and testing is one of the strategies. And so we have no plans to stop doing testing there, because it's going to be critical for the same population. As we get a better handle on throughput, which hopefully we'll be able to do by next week, hopefully we will then be able to start thinking about, are there smaller pop-ups with other individuals to help with that effort. And then I'm going to let Dr. Miller jump in.
I think Dr. Varghese covered it really well. I think, obviously we prepared ourselves with the resources and supplies logistically to be able to have some of these smaller clinics as supply gets where it needs to get in order for us to hit, as Dr. Varghese said, that balance of equity and efficiency. But last week was only the first week that we were at about 9,000 doses. And we really want to concentrate our efforts on the largest sites where we get the most throughput, the largest number of people vaccinated in the shortest amount of time. And then as we continue to grow and expand, we'll be able to utilize other facilities and locations. I do also want to remind folks that the federal government and the state continue to allot vaccine through other channels independent of public health. So for instance, the federal pharmacy program, over the same period that Dr. Varghese has experienced an increase in the dosage allocation to the public health division, we've seen actually a larger proportion of increases go through the federal pharmacy program to our private providers, Giant, Safeway, CVS, Walgreens, and others throughout the Commonwealth. And so we do expect, though, to see additional allocations from the state flow to, for example, private practices, pharmacies, and other larger community vaccination centers before we will be able to have additional doses to do some of these smaller neighborhood level pop-ups.
Thank you, Dr. Miller. I recognize that we still have 80% of the population in front of us, right? So, and as we go, there will be additional logistical challenges. So just a small follow-up. So what do we do to make sure that everybody has sufficient transportation means to the different, to the 4 sites? Do we do anything extra, or do we plan to do when we will have, hopefully sooner, when we will have to invite even more people to get vaccinated.
Sure. So I'll start, and I'll actually have Brenna finish up on this. I want to say special thanks to the folks at the Department of Environmental Services and Human Services, as well as the interdisciplinary team of parks and recreation and libraries that work what we call and know as the 799 hotline, and then those folks in DHS and Aging and Disability Services. Through our existing community-based organizations, partnerships, our nonprofit social safety nets, and our transportation network providers, we are actually assisting in what Brenna referred to earlier, some essentially case management and helping individuals one-on-one overcome some of the barriers in order to get vaccinated. So whether that is connections to transportation resources, one of the things we do particularly is make sure that the site has public transit accessibility and things like that. And I'll let Brenna expand on how the CVC partnerships are helping to enhance that effort. Yeah,
so it's been really amazing that working with our Legends team that Aaron mentioned, this team of folks that are helping individuals with unique scheduling needs, including transportation. So working whether it's through the STAR program or Metro Access, if they're eligible, working through taxi voucher systems. Arlington Neighborhood Village has a network of volunteer drivers, and they are been amazing. And you may have seen the Metro section this weekend highlighting the Virginia Dems ride to the vaccine clinic, proactively reaching out and working with our team for meeting transportation needs. So, there is a family of transportation services, and trying to match that transportation network service to the individual needs. So if someone needs a wheelchair van or an accessible vehicle versus if they can get into the back seat of a car, matching those up. And so if someone does receive a notification to schedule an appointment and needs assistance with a ride, they can call 228-7999 and we will get them connected to the team to help them arrange those.
Thank you.
But let me just say, I believe people can reach out directly to the Virginia Democrats in Arlington Neighborhood Village. They don't have to go through us if they need a ride.
Great.
Thank you, Mr. Chair. I took too much time. I yield.
No. Those are good questions, and it's actually the Virginia Democrats, but the Arlington Democrats in particular that were highlighted in the event. But I'll go to and we'll have follow-up questions, time permitting, but I'll go to Ms. Crystal first and then Ms. Garvey.
Thank you. And thank you for those good questions from Mr. Karantonis. I think we've all been eager to see a presence of this vaccination effort on the west end of the Pike because we've seen how important a testing facility there has been. I do think it just bears noting as a quick highlight. I think Dr. Verghese and Dr. Miller talked to us about some of the challenges of using Arlington Mill. I think we'd be remiss if anyone watching this session took away that we were prioritizing, sort of logistical needs above equity and reaching community members who most need this. If you look at where we actually have had locations of the clinics, be it Walter Reed Community Center in Douglas Park, be it Lever Run Community Center right on the edge of Buckingham, now Macedonia Baptist Church in partnership with Neighborhood Health. I mean, if you go back and look at our Destination 2027 public health plan, right? When you look at all of those maps by life expectancy, by percent of children living in poverty, I mean, these are the areas of greatest need in our community. So I would hate for anyone to take away that we're not, that sites to date have not been chosen on the basis of greatest need, even though I agree very much with Mr. Karantonis that there's more to do in reaching the west end of the Pike in particular. I just wanted to echo Mr. Dorsey, especially on the demographic data piece, and just a sincere thank you. It's clear from the output that this is complicated, and you all have shared this all along. And so just the effort to present this data, I know that our community is capable of seeing complicated numbers and helping make sense of them, and not letting that complication be a reason to not doggedly pursue its collection and now its sharing. I really appreciate it. I think this is incredibly important that our community conversations about equitable distribution of this scarce and life-saving resource be grounded in data. So to that end, just a request, can we please post that chart if it's not already on the vaccine FAQ page? And, you know, if it's, I understand that's not something we can update daily. I'm sure that was a huge undertaking. So I don't want to overpromise on its dynamicism, but hopefully we can update it, you know, on whether it's a couple weeks basis or whatever else. I'd really love to be able to point people who are interested in this question, as so many Arlingtonians are, to that data. I don't know if that needs a reaction, but if there's any reason to think we can't do it, now might be a good chance to raise that from our team. Okay, hearing none.
Well, yeah, while we're figuring that out, I'd just be a voice that also says, I know it's not easy, but this chart is outstanding, and I do support posting it, even though we know that there will be imperfections. But I don't know, I'm sure that might not be universally agreed, but I hope it is enough agreed. I don't know whether it's Dr. Varghese or Dr. Helfer who would answer that.
It is probably, for me, it's really more workload on the staff. So we're just going to try to incorporate it into the weekly process, but we cleaning the data, and then the same staff are involved with vaccine allocation decisions with the state. And just in the last 36 hours, things have changed 3 times. So we will try our best to have a weekly update on that data since we're the owners of that data.
And if it's bi-weekly, right, I'm enthusiastic about that too. You know, these weeks are ticking by pretty fast, and so I don't want to pull people off task.
It's an important task, and it does help in our own planning, but it's just been surprising how much literally the vaccine allocation decisions from the state have changed, you know, every 12 hours because as supply increases. So once it stabilizes more, this won't be even a hard thing to actually even say, yes, we'll be able to do it. It's just, I've never experienced this much change in even a weekend and in the number of requests that we've had. Can you do this? Can you do that from the state, not from the locality? So
if that led to the state generating and posting higher quality data, then maybe that effort won't be in vain, but thank you for all that you're doing. And I'm sorry to reward the amazing work on a very challenging question by asking another impossible question. But I'm wondering if you, either Dr. Varghese, Dr. Miller, or even Dr. Helfer, who's working on this communication, could potentially help provide some insight into, I think, the question that's really on everyone's mind that is incredibly hard to answer, which is, how are we doing on overall progress? You know, the percent of Arlingtonians who have been vaccinated, right? Like, this is the number that I think everyone is desperate for. We've heard figures like 70% of a community is enough to reach herd immunity. Even that is problematic. We're part of a region, right? We can't reach herd immunity for just Arlington's 26 square miles. But I think part of the reason we hear so much about, well, you know, there are disparities in what the state says about percentage of Arlingtonians that have been vaccinated relative to Virginians that have been vaccinated. And we know the state data is so problematic, and we've tried to encourage people to look at other measures. But I think it really just represents such a hunger for that answers to that question. I don't need to detail here. You're living it, the reasons that's possibly impossible to gather. We know people are being vaccinated by their, you know, employers, are being enrolled by their employers in other jurisdictions. We know people are getting vaccinated by the pharmacy program that we don't have insight into. We know that people are simply just going out of state to get vaccinated, that we don't have any insight into it. But I guess, let me just ask that question really broadly. Is there any way or any insight that we can shed towards that question of, you know, what percent of Arlington has been vaccinated, will be vaccinated going forward? Or is there any hope we may be able to answer that question with any greater confidence in the weeks to come?
I'll the back of the envelope calculation I can do, and it all depends on the denominator I use. So if I assume that there are at least 160,000 adults, and it's probably higher than that. So let me round that up again. Make that 180,000 adults in Arlington, because remember, this only can be used really by adults and then those 16 to 18. So if we have done 37,000 at least first doses for Arlingtonians, and that's probably, actually we need to go back. Let me actually pull up that graphic. Otherwise, I don't want to misquote information. So if we've actually vaccinated 31,000 Arlingtonians just with the Arlington efforts, and do that divided by 180, that's about 17% of the population. And then I do know that, remember, the Arlington data does not, this Arlington data does not include essential workers who are Arlington residents, but are essential workers in other communities. And then, so the Virginia data there could be useful without the demographics. So I expect that we're a higher percentage of Arlingtonians being vaccinated. And then I'm hoping a certain number of others are getting vaccinated in DC and Maryland, some percentage. So this is going to be an undercount. But if I'm going to do any back of the envelope calculations, roughly with 31,000 on the slide that we just presented with one dose, that means out of 180,000, we've at least hit 17% of the population.
Okay. And it's an unknown how many people could be.
Yes.
Somebody told me the other day who a constituent who works for the State Department was saying state had now set this goal of, doing 30,000 vaccinations. And we know, right, that there are a lot of Arlingtonians that work for the State Department. That is just sort of one insight into this. We just have no way of knowing who's getting a vaccine elsewhere. There's no way for the state pre-registration form for people to enter whether they've been vaccinated elsewhere. There's just no way to capture that. Is that right?
That's essentially correct. Unfortunately, because health in the U.S. has been a state function, not a federal function, that you have at least 50 different systems that do not talk to each other. I mean, this is not my pitch for national health insurance, but it would be really helpful to have one database that would actually be able to marry this information together, because we're hoping that there would be a day where the Maryland data goes to CDC, and then CDC could then say, all right, here's what we have for all of this data for each jurisdiction, but they probably at best could do it by state. And then how do you get it back down to the granular level? So just like anything else in public health, we use surveillance. We always know it's an undercount, but as we get higher and higher, if you see me talking about 70% in Arlington, that will be good, because that means I'm using an undercount and still reporting 70%. Yeah. So let's hope you see that number in that table eventually be 70% for Arlington, which means that we could probably say it's at least 80 or 85% or higher.
And then, I'm sorry, just one quick follow-up, and then I'll yield and save the rest of my questions for the next round. You were saying, this jogged my mind when you were talking about the state function. If we have residents of Arlington who are essential employees in other Virginia jurisdictions, do we get a set of those numbers from VDH? Do we know how many Arlingtonians have been vaccinated in other Virginia jurisdictions?
Yes, and that's actually part of the state database information. It's just that the reason why we don't mix and match, at least on this sort of data presentation, is on this, we were trying to present race and ethnicity data, and we know that we have fewer numbers of missing data for that. So we can separately say, here's the number that VDH has said are Arlington residents. We did not choose to present in that. So that's why I can comfortably say that this is an underrepresentation of that information.
But so you were saying, for example, that there are, we've given 31,000 first doses ourselves, so we can get to 17% of eligible Arlingtonians. I mean, would we be able to say on top of that, we know that, totally spitballing here, another 3,000 Arlingtonians have gotten vaccinated in another Virginia jurisdiction?
We should be able to, for Virginia, that's about the best we can do, right? Okay. We won't be able to get DC or Maryland.
Okay, all right. Thank you. That's helpful.
Great, thank you, Ms. Crystal.
And just to be clear, Dr. Varghese, that wouldn't include people who've gotten it at a pharmacy.
the pharmacies in Virginia need to report as well. So that would be, so the data that you see at the state site includes local health districts, any providers in Virginia, including pharmacies who are providing providing the vaccine. The undercount at that point will be then whatever's happening outside of Virginia won't be in that system. It's why communities like Richmond City residents it'll be a more solid number because they're in the middle of Virginia. It is unlikely that they're traveling outside. The border communities are the ones where we have the inability to say, because I think I've talked to you before, our healthcare system is integrated across the National Capital Region. We have people coming from Prince George's County to Virginia Hospital Center because they're Kaiser patients, and their hospital, one of the hospitals is Virginia Hospital Center. So it makes our region just a tad more complicated.
Before I entirely yield, I am hearing there's like sort of two other sources where we might be able to pull data from VDH to sort of answer that question about how many Arlingtonians have been vaccinated. It could be helpful in future conversations. I may be the only board member.
I am looking to see if I can find a chart already, but let me see if I can find something.
I don't mean to put you on the spot now. We could do it.
No. I mean, I can roughly, from what we know from the VDH database, I may get into trouble here, but if it's at least one dose of vaccine, according to the state database, we actually may have up to 54,000 people who've received vaccine. So, but that's why I try not to mix and match, because people are then going which source it is and so on. So for this presentation, I focus on race and ethnicity, which had the most complete data. So this is better news for the state at 54,000. So.
Thank you for that. That touches on something. I know we are limited time. I want to get to Ms. Garvey, but I have a question directly related to this. We have said, if you look, the VDH data is not perfect, but if anything, there's also 275,000 people in the VDH data that are not assigned to a jurisdiction. So is it a fair interpretation to say that the VDH, we've done at least as much as the VDH? If there's an error where the VDH numbers for Arlington would be undercounting what we've done, or is that as a whole with all the sources in the federal, or is that not an assumption that we could make?
I think, Mr. DeFerrantri, maybe like mixing and matching different information sets. So the people who are registered or pre-registered in the state, there was a time when they didn't know which jurisdictions they may have belonged to. That's the pre-registration side. That would not affect the vaccine side. So what VDH is using for the vaccine information is they're looking at their vaccine information system data to see ultimately from whether it's Arlington Health District, from CVS, or from Innova as 3 examples, or it could be Fairfax Health District. They're looking to see who has actually then received a vaccine that gets uploaded ultimately into the state VIIS system, and that has the location information. And so that's how they then say how many Arlingtonians from that system do they have on record. So if you take the one dose phenomenon, it's at least partial protection, and if it's J&J, it's complete protection. If you have 54,000 individuals that have received the vaccine who are Arlington residents, then when I did that previous 180,000 rough denominator for adults, that could be quite wrong, but it would get us to 30% of the population having received at least one dose.
Okay, thank you. That's helpful. Ms. Garvey.
Yeah, thank you. And thank you for all this discussion. I must say I'm having flashbacks to trying to untangle a big, huge wad of thread or yarn and trying to pull out all the pieces because the data is so complicated. Really appreciate you trying to figure it all out and get good information, everybody. If you've answered this question, I was having technical issues. If you answer this question, then please don't, because I know, Dr. Verghese, you got to leave at 4. But, I've been hearing, I think we all have, from people who say, I'm over 65, I pre-registered, I haven't got an invitation, I can't find myself, I can't get an answer, help. And if you might talk a little bit about how somebody might have gotten into that position, why? Because I think we're trying to reach out and think we've gotten to pretty much everybody, but people say we haven't. And then I know Dr. Helfer maybe wants to talk a little bit about, because I know she's very helpfully put out her own email for people to ask for help if they're in that kind of a situation. And Dr. Varghese, if you've got to go, that's okay. This is a question somebody else maybe could answer.
Well, I will start and then see what Dr. Helfer or Dr. Miller may want to add to it. So for all of the people that were pre-registered in the Arlington system before we turned over lists to the state, everything that we know, we've invited everyone in that system, okay? And then every single week that when we were done with the whenever we feel that we're done with 65, as we've said, people can change their minds and more people come into the system. We need them to have complete information in the system, because even if they get the date of birth wrong, they may know that they're 65, but if the date of birth field, for example, is not completed or is incorrect, we're not going to draw them down as 65-year-olds. So that's one of the first things that we ask people to make sure is at this point, regardless of where they may have been in the past, are they in the state system? Whenever we've looked, we usually can find not only their status as well as, and then reminding them, we saw evidence that they were invited, and then it's a question, have they checked their spam folders? Because that happens a lot. Also, if their email address is even off by one digit, one letter, remember, we won't know that. We will then send it to whatever we have on record. If we get a bounce back, the team does try to make the effort, if there's a phone number, for example, to try to find out what they need to change it. But otherwise, it's going to be hard unless it's something obvious. If we can see that a space was missing, the team, as a general rule, when that happens, will already remove that and try it again. So most of the time, I'm not going to say it's not possible that something has dropped, but as a general rule, we have been able to find not only the people in the system, we've also been able to find evidence that an invitation was sent. And then what we ask people to do is to look at their spam folders. But sometimes it could even be almost like the global spam filter. If a particular company sees that maybe there are too many gov delivery actions, they may prevent it from reaching someone to begin with, which is still not something that the county is going to recognize because it made it successfully out. So overall, hopefully people are going to realize we're doing, I think, the best we can. There will be some missing issues, and Dr. Helfer's team has been working on making sure that we can try to re-enfranchise anyone who may not have been able to get their invitations.
Thank you. That's very helpful. To sort of show all the different ways there could be a problem, and if there's a problem, people can't figure out what to do. Dr. Helfer.
Yeah, I would say that, if someone has checked their spam, they've checked Vaccinate Virginia, they know they're pre-registered, and they did it early, they should call 228-7999, and we can help verify that they are pre-registered. If you pre-register today, it may take a week or two for you to get the notification. But if you pre-registered in February and you're in 65 plus, or you're 16 to 64 with underlying conditions, we've been through February. And so I would say that if you're in that category and you're not sure, but you pre-registered in that time frame, call us. If you just pre-registered today, please give us a few weeks, because as Dr. Varghese mentioned, there are still thousands of people that we need to reach out to, and we are rolling on a rolling basis notifications. So I don't know if Dr. Miller or Mark Schwartz wants to add anything to that.
I just want to add, we have identified, as Dr. Varghese mentioned, I'll give you an example, Ms. Garvey, there are about 400 individuals whose information in the state pre-registration system did not provide an email address or indicated that they didn't have access to an email address and that they're 65 and older. We recognize that that is a significant barrier, and so we're taking efforts through that interdisciplinary team I mentioned with human services, parks, and library staff to actually call them, because we've flagged it, right, as we go through and individually say, this is an issue, we see this issue. We've got about 400 of them on that list, and we've started this week to call those individuals 65 and older, where we identified that as specifically a barrier and to make sure that they didn't essentially fall through the system.
Great. Thank you, Ms. Garvey. That actually touches on the one question I had, and then we'll see. We'll go around again if we can, which is I think it's for Dr. Miller. It's and probably actually Dr. Helfer as well. It's regarding phone calls. I absolutely understand why canvassing to this point has been too much. You want to preserve safety, but you know, I think that there's, in addition to that 400 you mentioned, Dr. Miller, there's another on that last slide. Maybe if it's possible, Dr. Helfer, if it still could fit up, there was 700 or 800 that were healthcare workers that we had question about. I guess I'm kind of interested in how much capacity, and is there anything we can do to have enough phone callers to cover the 762 plus 400. I actually got a text just before today's meeting with concern about the some of those who might want to get the vaccine, but just email is not their way of communicating. And so want to make sure there's enough phone callers. If there's anything, and if you have any sense of how quickly those 400 plus 700 phone calls, that's exhausting work, but it's still super important. So I don't know if you have a sense of how long that might take, Dr. Miller, or if any additional resources or any thanks to the Legends team or those working on this might be necessary. I guess maybe Brian, you first.
Yes, so we are actively working on building up the numbers in the Legends team. We also know that in addition to the 65-plus-year-olds with just phone numbers, that there is a group of individuals 16 to 64 that have just identified as phone numbers. If you recall, in the Vaccinate Virginia, you can identify what your preference is for phone, email, or text. So similarly, in those healthcare workers, if they don't have an email address and just a phone number, they would go to the Legends team for that phone call directly. But we are actively expanding the Legends team to build capability in that regard, because of, you know, there are a number of people that just don't use email, as you said.
Great, thank you. That's wonderful. I had one suggestion yesterday. I know a number of the Virginia Medical Reserve Corps, they sign and commit to being HIPAA protective, but we've hired some folks after they've done part-time. And so I just throw that out there because I do think phone calls are likely to be a key way to reach some folks as we go forward. Nothing wrong with what we've done, in my view, to this point, but going forward, it's a thought. And I think we had Mr. Dorsey next, and then Ms. Crystal and Mr. Karantonis.
Thank you. I just wanted to pick up from Ms. Garvey's line of questioning about ways in which people who are otherwise sure that they're registered may have been left behind. And I can say it from real close experience that if you use any of the various abilities that are available through Gmail to put things into different priority categories, make sure you're checking all of those. If you use any of the various services that wrap up subscription emails, be sure to look in that folder, because Arlington County Gov is a subscription service, therefore it could be wrapped up in that. And then another piece as it relates to it, be on the lookout just as you're looking for these emails. In the subject line, it will say invitation to schedule COVID-19 vaccine appointment. So you can use those as keywords to search for. And if you do find it, you can still use that link even if you got it several weeks ago. So, the first step, in addition to everything that's been mentioned before, do all of those searches. If you find it, go ahead and use it. And if all else fails, feel free to call.
Thank you, Mr. Dorsey. I think it's perhaps a quite closely enough held conclusions. Thank you for working us through those potentials, those specifics. Ms. Crystal.
Could you, I'm sorry if this went by already, but pretty quickly, could you all define what the Legends team is and what they're doing?
Sure, I'm sorry. So I have, first of all, I will say this, as you know, I say this a lot, whole of government, whole of county government effort, and I cannot stress that enough. I have little nicknames for all these teams that we've put together and composed of things. The Legends team is a group of county employees that was originally created, you may remember, to reach all those individuals who had their appointments canceled by VHC. Mm-hmm. So the same team, which consisted of a core of aging and disability services personnel, some other Department of Human Services personnel, but there's also some Parks and Rec personnel, DES, libraries, and a few other individuals from departments I know that I'm missing. But they are essentially a second line, I'll call them second line call center support and case management support. And so these are the types of issues that they help us address. Okay. We call them legends because they're living legends. They are, and they help us with our living legends within the community too, more importantly. They're, our little strike force that helps us go and tackle some of these very complex sticky issues.
Excellent. That's really helpful. Part of the reason I ask is because let me start by prefacing this. The folks who've been working the 7999 number, I mean, just deserve the thanks from not only this board, but this entire community. I think, in the past, Dr. Miller, you've shared with us the sheer volume of what they're handling, and considering that probably none of them have call center staffer in their job description, it's remarkable. That said, I think it's a lot to expect them to not only provide the most common answers to common questions, but also handle these hyper-specialized cases. And so it makes sense that we would have the Legends team. And we have definitely heard a lot. I think all 5 of us as board members have heard a lot over the last couple of weeks are these folks, I think Ms. Garvey described them best. I'm pre-registered, I haven't gotten my call yet, right? And there are a whole bunch of reasons that could be. I think that the first level triage, the 7999, are prepared to walk them through their spam filter, making sure the registration's right on the state pre-registration website, if that's relevant. But there are also just more specialized cases. And I think when people can't get when people can't get that issue, their specific issue resolved on the 7999 number, they extrapolate and assume that means that there must be hundreds and hundreds more like them, and the county's data system's falling apart, et cetera, et cetera. Can people call the Legends directly? And if not, are the call takers at 799 prepared to kind of refer them up the food chain and say, I'm sorry, this is too complex an issue, I need to get you directly to some case management?
Yeah, the latter is the case. We essentially have set this up the same way you would any professional contact center, with certain lines of support, supervisory support. For example, there's a back-end chat with call takers, supervisors, and problem solvers throughout the county. So, Dr. Helfer is in that chat right along with some other staff members. So we've set this up in a system so that we have a door for folks in our community to be able to go through, and then on our end administratively, we have the ability to escalate up, flag issues as needed, and then go from there.
Okay, that's great. That's really helpful. And I suppose anybody who's listening to this who's not getting the answer they need on 799, if the call taker doesn't get you there, then ask for a Legend. Thank you. The only other question I have is a really straightforward one, which is another complaint we've heard about a lot. When you receive the scheduling link to schedule yourself because your number has been called, my understanding is you've got a big old headline that says, please don't share this. What happens when someone does anyway?
Great question. We know, we check the list. We actually every evening do some reconciliation between our employer invitations and our individuals that are in the, as you saw, the exposure risk and the complication risk. So we verify the list, one, because we want to make sure that we have it right. We want to make sure, this is a principle of patient care, that we've got the right person, right? We've got the right number of doses. We've got all of the right things in place to be able to provide the public with the vaccine that next day. And we do send people a note, let them know that there may be a problem, for instance, Sometimes it's a miscommunication. They clicked the wrong button when they were signing up for their appointment. That's an honest mistake. So we'll send them a note, try to get that clarified there in the moment. We have some staff on the back end on the email inbox who help to manage that. If we're unable to get that clarified, they'll escalate that up. For example, I myself handle federal departments and agencies where there are questions. So for example, a DOJ employee, a DOD employee, things like that. Those then get sent to someone else to be able to handle and look into. And then, for example, where somebody just doesn't meet the eligibility criteria, we explain it to them very politely, let them know that we'll keep them in the queue, but unfortunately can't honor their reservation because of limited vaccine supplies.
Thank you.
I really appreciate that. I think that between that and then what Dr. Verghese shared as well about we are overscheduling folks. We are not ending up with just, hundreds of vaccines at the end of every day and throwing open the door and ringing a cowbell and asking everyone to come in. I hope folks have some slightly more confidence in our system between the validation of people who maybe are getting sent the link when it wasn't their time, and knowing that we really are very focused and are succeeding in getting these shots to people who are eligible, because we actually overschedule so that there aren't leftover doses at the end of the day. This principle of fairness has been an important one that's been guiding the work so far. So I appreciate that. Thank you.
Thank you, Ms. Crystal. Mr. Karantonis.
Thank you, Mr. Chair. Quick question. Because this has happened many times, and it's just a principle thing. So we have some people who have been scheduled, who have been received, have received an invitation. I'm talking about mostly, and we have constituent input in this. They are, some octogenarians or even older. For some reason, for example, they have been scheduled in an odd way. Maybe the caregiver is an Arlingtonian, the person that's cared for is not an Arlingtonian, it's from Falls Church, but they get the invitation, they come to the center, they get to the desk, and then they say, oh, I'm sorry, you're not an Arlingtonian. And these are cases that are, a little bit really to the edge. So is there an instance, is there a way to make quick decisions in exceptional cases where it's obvious that this is a person that needs to be vaccinated yesterday, and make an on-the-spot decision now that we have a little bit more of a, for flexibility, a little bit more of a vaccine supply to be able to afford those, quick decisions on the spot?
So no, I will say, look, our public health staff and as well staff from emergency management, for example, participate as pod site directors. Both Dr. Verghese and I have made sure that we empower those teams with the appropriate authority to be able to do what is right for our community and for those individuals as we need to. Where we miss the mark, we always want to know so that we can go, talk to folks and make sure that we are, making sure at the forefront that we're putting folks' health, safety, and security, top of our mind. So we empower them to be able to make those decisions. We don't want to add layers of bureaucracy in those instances where somebody is there. I have the full faith that I know for my team, support them in making those decisions and hope that they are catching those and doing the right thing for folks in our community.
Yeah, and I appreciate that, Dr. Miller. I know, I've seen how that you did, but sometimes, there was not a clear instruction. What do I do if I have, what do we say to this person? Look for whom? I mean, like the famous, can I talk to your manager? That doesn't really exist, right?
So I'll tell you, one of my, I have a couple of things that I keep as core tenets. So one is find the pathway to yes, right? That's what I always tell my folks. The site director is sort of at the head of the site for every one of our vaccine sites, but there are a number of different individuals throughout the management structure. So we follow the incident command structure. So there are public health professionals, emergency management professionals, other medical professionals, and Reserve Corps volunteers there. You will always find a county staff member in one of those positions of leadership that can make that decision. So the site director is at the top of the list. They are, sort of much like your battalion chief or your police officer or firefighter on that scene is everybody. They are the ultimate authority. That site director is vested with the ultimate authority to run that site.
Okay, and second question for my understanding. So I've been hearing from constituents the following situation. Arlingtonians, so residents in Arlington, having working 1B eligible jobs, for example, grocery workers, but in a different jurisdiction. They get an invitation from us. They're coming to the desk and then they're rejected or they're canceled the day before. What can be happening there? I heard that already 3 or 4 people.
Yeah. So one of the things that we have to remember is the instructions from the Virginia Department of Health have been to vaccinate essential workers within your community and where, based on their location of work. So if somebody is an essential worker and works in another community but lives in Arlington and is eligible that way, they should be getting the vaccination through that community. What we're seeing a lot now as we've expanded through is that many people are also eligible because they, for instance, are between 18 and 64 and have a health condition.
Yes.
Right? And so when you register, and the folks that have signed up for an appointment know what I'm talking about, you have to click a category to let us know your category of eligibility. What we're finding is that some people think, oh, I'm getting this invitation because I'm this category of essential worker, when in fact, they have registered in the system as an individual eligible with an underlying medical condition. And so what we see is when we get the list and we go to reconcile, we say, wait a second, they said they're an essential worker. I don't see them on that list. We do our best to sort of say, okay, look, maybe they fall in another category. Sometimes we don't always catch it. What I'm hearing is more than likely that's what's happening. So we need to make sure that folks remember there is more than one pathway to eligibility for the vaccine. It could be through the essential worker status, but it could also be because they are between 18 and 64 with an underlying medical condition. I know I had one of those flagged for me this week because the individual was a federal government employee. As I said, those come up to me. And then I helped clarify that situation, get them navigated through, and we're able to get them onto their vaccine appointment. So that is how it's supposed to happen. If it is not, let me know. I'm happy to look into those cases and we can deconstruct individually what's happened in those instances.
Thank you, Dr. Miller. I'm a little bit concerned about that, frankly. And I can tell you also there's an equity dimension to that as well, because almost 100% the constituents I heard it from or about where this latest cohort of 1B eligible jobs that are low-paying, medium and lower income jobs, grocers, and they are really exposed and being invited, being rejected, and back and forth. This is really a lot of stress. And by the way, they don't have all the flexibility of the world from their employers, to just jet over to the vaccination site and back and take all these hours off. Thank you. Thank you.
Yep, understood. I'm happy to take that offline and we'll work that case.
Thank you. I see, Mr. Dorsey, did you have any other questions? Or are you good? Okay. A vestige of a hand. I want to just see if I can try and summarize 3 thoughts. We are seeing much more supply, 5,000, 8,000, more than 9,000 in the last 3 weeks. And I'm confident we're going to keep seeing more supply. So more supply, we're working away on, and we are now, we have an analysis of the equitable distribution of doses and that data that we showed today, and we're going to seek to post as well. If you are struggling, the Legends team is a second line of customer service through the 7999 number that you can access to help address this. And I think Dr. Miller and all the questions that we've had earlier today show that we have a system of working to get to as many people as possible that has integrity but isn't perfect. And so we're working hard to try and serve you. With that, that will be the end of our work session. Thank you to for all the questions and to staff for leading us forward on that. We will now go, I will make a motion that we will move into a closed session. I move that the county board convene a closed meeting as authorized by Virginia Code Sections 2.2-3711A1 and 8 for the purpose of discussing two personnel matters concerning appointees of the county board and for consultation with the county attorney concerning the county board's authority to establish a law enforcement civilian oversight body pursuant to Section 9.1-601 of the Code of Virginia and the role and responsibilities of such a body relative to existing powers and procedures of the county. Is there a second?
Second.
Second.
There's a motion and a second. We'll go ahead and take the vote. I did see Ms. Helfer's, your picture pop up. If there's something you urgently need to add after we take this motion just by way of announcement, we'll hear you, but certainly if not, you're good. Then we'll just have the vote. I'll go with a roll call. We'll start with Ms. Garvey on the motion for closed session.
Aye.
Mr. Carantonis.
Aye.
Mr. Dorsey.
Aye.
Ms. Crystal.
Aye.
Mr. DeFranti votes aye. Colleagues, we are in this session, this Teams room, and we will switch out the people in the room so it's just those who need to be here. But for our public, closed session starts now. Arlington County Board back in session. In open session, I'll make the following motion and we'll do a roll call vote. I move that the members of the county board certify that at the just concluded closed session, only public business matters lawfully exempted from open meeting requirements under Chapter 37, Title 2.2 of the Code of Virginia, and only such public business matters as were identified in the motion by which the closed meeting was convened were heard, discussed, or considered by the board. We do not need a second. We'll do a vote. Start with Mr. Carantonis.
Yes.
Ms. Crystal?
Member Carantonis?
Oh. Go ahead, Ms. Crystal.
Aye.
And would the clerk go ahead and call the rest of the roll, please?
Board Member Dorsey?
Yes.
Ms. Garvey?
Yes, I'm here. Aye.
And Mr. DeFerranti?
Thank you very much, Mason, and thank you, everyone,
You
colleagues.
didn't vote.
Thank you very much. I vote aye as well. Thank you. There's my moment of forgetting for the year at least. But we are adjourned. Adjourned. Thank you, Mason. Thank you all.
Thank
Good
you.
night.
Sorry, Matt, just want to make sure you voted.
Thank you, Libby.
See everybody.
Thanks, everyone.